Are you filming?
I'm David from St John Ambulance, just here to demonstrate to you how to use your LifePack CR2 defibrillator. So this is your unit here, all ready to go. I've put it all together now for you, so it's ready to save a life. Has anyone seen anyone have a heart attack or a sudden cardiac arrest or anything like that? You have? Are you comfortable about talking about it?
Oh, yeah.
Yeah? So can you tell us what happened?
Well, playing tennis, we've had two.
You've had two? Incidents?
Yeah, two. The first one, I think it's dead before he hit the ground.
Yep.
And the other one, we ended up being able to get an ambulance and we had 2 stents put in there.
Okay. Did the second one lose consciousness at all?
The second one,
Yeah.
no, we just
Just had the heart
gradually got worse.
Sure.
It was gradual.
Does anyone know the difference between a sudden cardiac arrest and a heart attack? Anyone will have a guess?
Without a clue. Without
Will have a clue? That's okay. I didn't expect you to know, so that's a normal answer. The difference between a sudden cardiac arrest and a heart attack is a heart attack is like the second one you said. You can get chest pain, pain in the arm, and you're like, yeah, I'm not feeling too good, I need an ambulance, right? Sudden cardiac arrest, you have no warning signs, okay? I think we've got a late comer. Come on in.
It's late.
It's alright.
I was trying to find your phone.
If you want to come around or wherever you want, no problem. Sudden cardiac arrest, you don't get any warning signs. If I could do it in tradesman's terms, a heart attack is more a plumbing issue, so you've got a blockage in the artery and the heart is working hard to get blood through that blockage, and the heart says, you know what, I've had enough of this. I'm going to give you some signs that I'm not well, so that's where you get the chest pain and all those things. Sudden cardiac arrest is an electrical problem, okay? So I could go into a cardiologist right now and give me the full workover and say, you're right as rain, and I could walk out and it will happen to me. So there's no underlying issues or anything like that, or there might not be any underlying issues or anything that may trigger it. It just sometimes happens. Now, in Australia, our survival rate for sudden cardiac arrest, not heart attack, sudden cardiac arrest is less than 5%. The reason for that is access to this. Okay? This is the only thing, along with CPR, that could save your life if you're having a sudden cardiac arrest. If you don't have this, then you've virtually got no chance, which reflects the 5%. So every minute you don't defibrillate someone that's suffering from that condition, you lose 10% chance of bringing them back. Average ambulance time in New South Wales, in Metro Sydney, is 11 minutes. So how many percentage do you have there? 0. Okay. So that's why these things are becoming popular, and that's why the Office of Sport has put out grants to have more of these accessible, so anyone can use them if there's an incident that occurs. Okay. How are you supposed to determine what the difference is? You're not. Okay. You don't have to determine. The only thing that you need to look for is if they're conscious and if they're breathing. Okay? If they're not breathing and not unconscious, of course they're not going to be conscious if they're not breathing, but if they're unconscious and not breathing, then you say, get the defibrillator, you call an ambulance. Okay? And whilst the defibrillator's being fetched, you'll commence CPR on that patient. Okay? Because they're not breathing, you need to manually do what their heart is supposed to be doing. Okay, so you're doing that 30 compressions to 2 breaths. Okay? When the defibrillator arrives, you just open up the lid of the AED.
Adult mode. Remove all clothing from patient's chest. Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin, exactly as shown in the pictures. Press pads firmly. Apply pads to bare skin, exactly as shown in the pictures. Do not touch patient. Analyzing heart rhythm. Everyone 1 clear. Do not touch patient. Delivering shock. Shock delivered. Provide chest compressions to the beat. The heel of one hand should be in center of chest. The other hand should be on top of first hand. Push down hard, at least 2 inches. Provide 2 breaths. 1, 2. Resume chest compressions. Push down hard, at least 2 inches.
So, as you can see, did I do anything, or did the machine do everything for me? All I had to do was put the pads onto the patient's chest. That's all I did. Then the machine will analyse the patient, and it will determine whether that patient needs a shock or not. So in this instance, the patient had a shockable rhythm, it sent a shock through to the heart, then it asked me to do CPR. Okay? You'll do CPR for 2 minutes. At the end of 2 minutes, we'll ask you not to touch the patient, and it will analyse again to see if you need another shock or not. And that same process will repeat itself over and over again until 1 or 2 things happen. What could they be?
He's either dead or he's
He could start breathing, or the ambulance arrives. We don't determine whether they're gone or not. Okay? If you're doing CPR, they're already dead. You're just trying to bring them back. Okay? So you don't stop under any circumstances unless they start breathing, which then you'll put them in a recovery position, make them feel comfortable. They may or may not regain consciousness. Okay? They may not. So if they start breathing, just put them on their side, hold their head or put something under their head. Leave the pads on, just ignore the CPR, because that won't determine whether they're breathing or not, it will only determine the heart. And just leave the pads on, so if they go back to it, if they stop breathing again before the ambulance arrive, put them back and you start your compressions again. Okay? And every 2 minutes we'll analyse their patient to see if they need a shock. And now on average you'll analyse 2 to 3 times until the ambulance arrive, roughly. Okay?
So will the machine analyze the patient every 2 minutes?
Yes. So every 2 minutes we'll ask me to stop CPR, it will analyse, and then it will say whether another shock is going to go
It
through.
will tell you whether
Just like it did at the start. Any other questions? Yes?
Actually, how hard do you push down?
Yeah, at least 5 centimetres. 1/3 depth of their chest. So it's pretty deep, so you've got to push pretty hard. And as you could hear, it's had a metronome. That's the rhythm that you need to be pressing at. Okay?
Not going to break their ribs or anything
You probably, if you're doing it well, you probably will break it.
Can you change that when someone is starting to talk?
Absolutely, I would recommend if there's other people around, every 2 minutes, when it's analysing, then you just take out and someone else steps in. Speaking from experience, I've done it for 12 minutes straight, and I was knackered.
Yes, that's right.
Absolutely knackered. Any other questions?
What about the machine itself? I mean, it's battery operated, I understand. How often do you have to change the batteries?
Every 4 years, unless you use it. Won't last you 4 years if you use it, but if you don't use it, it will last you 4 years. And in that time period, it will analyse itself on a weekly basis. So it will check all the internal circuitry and everything else like that. It will actually give itself an internal shock to make sure that all the components are working. And if it is working, there's a little green LED light that flashes there. That means it's okay. And if it's not okay, it will flash red and it will actually send off an audible alarm. It'll just go beep every minute or so, or 30 seconds or so, about beep. We'll just send a bit of an alarm off. Okay?
So David, if somebody collapses on the court,
Yes.
and not through injury or anything else, just collapse, you think, oh, they're fainted or whatever, you don't fiddle around, you bring the machine out.
Yeah. So usually I would imagine on a tennis court there's more than 2 people here.
Yeah.
Okay. So if I was the person that was closest to the patient and they collapsed, and I'm checking them out and I realise, oh, they're in trouble, they're not breathing, or anything like that, I would actually scream out saying, hey, someone get me the defib and call an ambulance. And straight away I'm doing compressions.
You would only do that if he wasn't breathing.
Correct, if they're not breathing.
Check.
If they are breathing, you can say, call an ambulance, bring the defib out, and just put them in the recovery position, and just wait for the ambulance. If they stop breathing, compression.
So,
What's the best way to check if someone's breathing?
Very good question. So obviously, you're normally kneeling, they're not on a table. So you put your hand on their chest, okay? And then you put your cheek next to their mouth. You'll be able to feel the breath against your cheek, but you're also watching your hand to see if it rises and falls. Okay? So they're the touch, feel, and look, listen, and feel. So then you can see those things, and then that's the best way to determine whether they're breathing or not. Okay?
So your hands, how do you?
However you feel comfortable, but it has to be from the armpit to armpit, right in the middle. That's the best way.
So
I feel comfortable doing it like that. Some people feel comfortable doing like that. But the important thing is one hand is in between and the other one straight on top. However you want to do it after that. Some people go like that. Some people go like that. It's just whatever you feel comfortable. And always elbow straight, not bent. Why is that?
You're not pushing enough pressure? Yeah?
You could be pretty strong to do it that way. You're going to get tired pretty quick doing it like that because you're using arm strength instead of your whole body. So you're actually not using your arms at all by keeping them locked straight. You're using your whole body to push down.
Okay.
If you're doing like that, then I'm just using my arms to do that for 2 minutes. Tough work.
Now, there's going to obviously be, if it's a lady who collapses, it's on